Hello and welcome to Single Payer Radio. I'm Paul Hoppy, broadcasting from the Habron Building in Louisville on the WFMP 106.5 Forward Radio Community Network. Our programs air every Monday at 2 p.m., Tuesday at 7 a.m., and Wednesday at 11 a.m. And we also stream our show on SoundCloud. We produce this program because we believe healthcare is a human right. We advocate for a national, not-for-profit, publicly funded, single-payer healthcare system that works for everyone. The views and opinions expressed on our show are those of the speakers and not the station. Our station relies on volunteers like myself and your ideas and donations to keep us on the air. And now I'll let Kay Tillow, the chairperson of Kentuckians for Single-Payer Healthcare, get us started. Kay?
My name is Kay Tillow, and you're listening to Single Payer Radio, a program produced by Kentuckians for Single Payer Healthcare. I'm going to let the people that are here with me today introduce themselves before we get started. Paul?
Hi, I'm Paul Hoppy, and I live in Louisville, and I've been with Single Payer Healthcare for about 4 years now.
And Harriet?
Hi, I'm Harriet Seiler, and I've been a member of Kentuckians for Single Payer since 2004. That's an awfully long time. And I'm originally Canadian, but I've been in the United States many, many decades. Thanks.
Hamza?
Hi, I'm Hamza. I'm a second-year medical student at the University of Louisville. I'm one of the newer members of this group, to which I found after connecting with, or after becoming a 2024 Physicians for National Health Summer intern.
And Evan?
Hi, I'm Evan. I'm a second-year medical student at KICOM in Pikeville, and I've been a part of Single Payer Healthcare for about 5 months now.
And now I'm going to turn this over to Steve Katz, who will introduce himself and then introduce our guest for the program.
Okay, Kay, I'm Steve Katz, as you said. I live in Lexington, and I've been in this group for, I guess, about the same term as Paul has, about 4 years now. But our special guest is Lexington's Vice Mayor, Dan Wu, who shocked me. I was watching the proceedings on Lex TV on my computer about a month ago when the city council, which Vice Mayor Wu presides over, was discussing how to allocate the fund balance. To cut through the red tape, so to speak, the fund balance is basically leftover money at the end of the year, and all the different council members and the mayor make proposals on how to spend it, and they all vote to see who gets the money. Well, I'm associated with another nonprofit that was hoping to get a little something from the fund balance, but Vice Mayor Dan Wu made a presentation proposing that the city spend $1 million from the fund balance to buy $100 million worth of medical debt owed by Lexingtonians. And I was just so impressed. I mentioned it to this group at our last meeting, and everybody else was impressed too. So, Dan, can you tell us what raised your concern about medical debt? What prompted you to take this action?
Well, first, thank you all for having me. I'm always excited to talk about this topic. It's been something that I've been working on in an official capacity for just about 2 years now. Medical debt, I think, has been on my mind, just like pretty much everybody else that has to deal with our terrible, health insurance system that we have in this country. Harriet, I don't know how you can stand it being here when you're coming from a place like Canada that doesn't have these kind of problems. But this particular issue, the idea of relieving medical debt, came to my attention when my friend Rona Roberts sent me an email. Rona just happens to be the wife of our former outgoing Vice Mayor, Steve Kay. So she's been a friend, and she would send me articles regularly just about this and that, things happening in different cities, kind of fun ideas. And she sent me an article about, and I can't remember what city it was, but it was a city or county, probably like Cook County or in the Chicago area, Illinois, um, that was using ARPA dollars to relieve medical debt. Now, I had known for a while that um, on the secondary market, debt collectors can buy medical debt from hospital systems for about 100 to 1 on their money and then try to continue collecting that debt from patients. This organization called Undue Medical Debt, they used to be called RIP Medical Debt, they were basically started about 10 years ago by a couple of former medical debt collectors. And I'm guessing that maybe one day they woke up and realized that they were the bad guys and decided to use their resources and their know-how for good and created this nonprofit. And so for the 10 years now, they have been basically buying up medical debt using donor funds. And then instead of collecting on it, they relieve it. So people would, benefiting from this would literally get a letter in the mail saying, hey, guess what? That $2,000 that you owe to Baptist Health, gone, relieved. And it's a pretty amazing system. And again, they're buying it for 100 to 1 on our money too. They do all the administrative stuff. They do all the negotiation with the hospital systems. The only thing they don't do is put up their own money for it. So they're donor funded. In the past, it has been nonprofits, church groups, community groups, literally just regular people getting together, putting together their money and buying up this debt. Only in the last couple of years has it attracted the attention of cities and municipalities, and now even states are kind of getting in on the action. So when I heard about it, it sounded like a really amazing opportunity and about the best return on investment you can ever imagine, getting 100 to 1 on your money. So I got in touch with Undue Medical Debt and been having conversations since then. I put an item into our Budget, Finance, and Economic Development Committee earlier this year to study it. And then I had an information session, I think late summer, where I invited a lot of community members, nonprofit organizations, and representatives from all of our major hospital systems, plus Lexington Clinic, all showed up to kind of get more information about it, just to get that community buy-in. And so it all led up to around October, late October, when I proposed using $1 million of our fund balance. And as Steve said, it's basically our surplus that we get to kind of play with every year. And I proposed using $1 million of fund balance money to hopefully buy up $100 million worth of debt in Lexington. And it was unanimously approved by council. And now we are in contract. We're about to go into contract with Undue Medical Debt, and off we go.
Well, how does it work? Exactly who will benefit from this? How many people? Will they all be Lexingtonians? And how many, approximately?
Yes. So the way Undue Medical Debt works is the only two real qualifications you have to be eligible is you have to earn within 400% of the poverty level, or or have your medical debt be more than 5% of your annual income. And that's really it. You don't have to apply. So people don't even have to know about this program to benefit from it. In our case, because we're using Fayette County money, it will only apply to Fayette County residents. So if it were another organization that didn't have that particular caveat, you can kind of target whatever group of people that you want for it. At this point, we go into contract with them, and then they would start purchase negotiations with the major hospital systems. So in Lexington, that's UK Healthcare, Baptist Health, and St. Joe, and probably some of the smaller players like Lexington Clinic as well. They would go into negotiations, figure out how much debt they have on hand, how much debt they want to sell, how much they want to sell it for. And then they would come back to us and say, hey, we reached a deal with such and such, and we need a check for X amount. They would buy up that debt, and then we would send out basically a co-headlined letter, a letter with undue medical debt on the letterhead and Lexington and Fayette Urban County government on the letterhead. And we would mail it out to all the patients who were having their debt relieved. And so one day you would get in the mail a letter saying that your debt is gone. A big part that we realized and we really wanted to do differently than what's been done in the past. In the past, a lot of folks have basically just kind of cut this check and relieved debt and kind of been done with it. We realized, and undue medical debt realized that medical debt relief, while it's a huge move, it's still a Band-Aid. It does not relieve the underlying problems that cause people to enter medical debt, right? Those are health issues, those are economic issues, there's some educational issues as well. So what we don't want to have to do, and I do not plan on asking for this money year after year to keep slapping Band-Aids on, so to speak. What we want to do when people receive these letters is also receive a resource guide that can connect people with all the ways that they can access free and reduced healthcare here in Lexington, get help signing up for Medicaid, Medicare, get help with financial education, all kinds of different other resources that already exist in the city. We don't have to reinvent anything. All these organizations already exist, all these programs already exist. What we want to do is kind of be a one-stop place to kind of point everybody to all these resources. And hopefully, I know we won't be able to get everybody, but hopefully keep some of these folks out of getting into medical debt in the future.
Dan, do you have any good idea as to how much what is the total of medical debt in Fayette County?
Yeah, so that $1 million was based on their ballpark estimate. So they're basing it on demographic information and kind of making a guesstimate at it. So we're looking at ballpark for affecting 40,000 Fayette County residents. Now that's 40,000 out of 325,000. That's 1 out of every 8 residents in Lexington could be potentially affected by this. And that $1 million will buy us over $100 million in debt. So I think it averaged out to be somewhere around $2,500 per person, give or take. And we won't know the exact numbers until we actually buy this debt.
I saw on the Kaiser Family Foundation's website, they had a study that showed that 12% of all Kentuckians owe medical debt, which is more than the population of Lexington. It's more than 400,000 Kentuckians owe medical debt.
Yeah. And I'm guessing too, like part of what they're collecting on is the less active medical debt. So if you just got a medical procedure last month and people hospitals started collecting on you, you wouldn't be in the numbers that we're talking about. We're buying up older uncollected debt. And I read another statistic recently too that 60% of all debt held by Americans is medical debt. Like more than credit card debt, student debt, every other debt combined.
Actually, I read 70%, but I suppose it's in that same ballpark. And I have to point out that this is unique to the United States of America. There's no place else in the world that even knows what medical debt is.
That's right.
Harriet?
Well, this is Harriet, and it's true, having been born and raised in Canada and with lots of families still there, medical debt is something no Canadian. Now, they might have some old dental bills, and for a while there were some pharma problems, but the Canadians are even planning now to cover those things. However, this was hard for me to understand because I don't do economics very well. And as Steve said, he was astounded that the council and I guess the people of Lexington said, this is fine. Did you get any of those people who they're around who say, well, those people should have paid their bills. And why are we helping people? They need to get out there and work and pay their bills. Did you get any of that sort of response?
Honestly, I didn't really face as much pushback as I expected. The main pushback that I got from folks we're the kind of the same folks that always just, if you want to spend money on X, they're always asking, why didn't you spend it on Y? When we put money into a parks program, then people will say, well, we have homeless people. Why are you spending money on parks? And, for us, it's not an either or. Our funding goes to all kinds of different parts of our community. So we got a little bit of kind of general pushback of why this instead of that. But I think most people maybe have a fundamental understanding that nobody chooses to have medical debt.
Right.
Like when you put money on a credit card, you're going to owe it, and you choose to owe it. It's a choice for, and I'll say this, like there are some people for sure that can't make ends meet, and they end up putting expenses on credit cards just to get by. So it's not fully by choice, but literally nobody says, I'm going to go into debt for this medical procedure. Very often it's people who don't have insurance at all. And a lot of it is people with insurance, but you hit your deductibles and you start going out of pocket. So it's not just the uninsured. So I think it hits differently for a lot of people. It's not the same kind of discussion that you would have around credit card debt or even student debt, right? So I think people seem to understand that. So I was prepared for more pushback than I actually got, which is pretty great.
That's great.
I've just read an article from MedPage that said 1 in 3 of people who are on Medicare have difficulty in paying their bills. So even with our best plan, which is publicly funded Medicare, that's pretty covers everybody, the deductibles and the gaps and the lack of coverage and the co-payments are causing people misery. And one of the worst things about it is when people have debt, they avoid going to the doctor or to the ER, et cetera. So we're seeing, in addition to the problem of the debt, we're going to see people get sicker and deny themselves care, which is so tragic that it's incredible.
It's basically a vicious cycle at that point, right? It's people not going in for preventative and regular sort of maintenance care. And then these are the folks who go to the ER kind of as their general practitioner, and rack up these huge debts because of it. And ultimately, they're not resolving their underlying health issues, right? They're getting Band-Aids slapped on them, metaphorically, when they go. And people wait until the very, very, until their situation is really, really bad. And of course, those solutions are, not the best solutions, and they're not going to solve those underlying problems. So it is this vicious cycle. And as long as health insurance in this country is a for-profit business, I don't know that we get out of that death spiral.
I wanted to ask a bit about just like, are there other potential benefits, from just relieving debt? Might be a little bit related to what Kay was just mentioning, but like relieving debt by itself for those people that need it will, as a ray of hope for them. I wonder if there's any other benefits that you think will come from this.
Yeah, as Kay said, certainly the health benefit that people would be more encouraged to go and seek health care. It will relieve people's pocketbooks, those that are still trying to pay this off a little bit at a time. I mean, I know plenty of people who make regular payments to their medical debt, and their medical debt continues to grow because their payment is less than the interest that they're accruing on it. So they're just, they're digging, but the hole just keeps getting, bigger and bigger. The other part is on credit score. Now, I know the Biden administration had proposed removing medical debt from credit scores. Last I saw, I don't know if that has fully gone through, and I don't, and again, any kind of executive action we know can be easily reversed. So that's not a guarantee either. I think it's a great move for it to be removed from credit scores. But if it doesn't happen, it means that this kind of medical debt relief is still really important.
Just today, I actually did some research on that because to tie in with this radio program, and to answer your question, no, I don't think anything's went through on it. And I also looked at all the pending legislation that's out there right now, and every bill that's been submitted is stuck in a committee somewhere. It's never going to see the light of day. So, I mean, the work that you guys are doing is tremendous, and I applaud you for it.
Right.
It- it's heartbreaking to me the way people have to deal with this medical debt.
Yeah, and from my perspective too, and I think about this a lot with my work in general as a city council member. We don't have the power and wherewithal to effectuate change on the federal level. We don't have the power to effectuate change on the state level. Federal level are not things we want to be happening, are not things that we support, right? So we're always looking for these little nooks and crannies and spaces of what can we do. If we can't change from our seat, if we can't change the healthcare and the insurance, industry writ large, what can we do on the local level that doesn't violate a state law? That is something that's feasible for us in terms of funding. What can we do? So when I saw this idea of medical debt relief, I was like, oh, this is definitely something we can do. You know what I mean? Like $1 million is a lot of money, but in the context of a city budget is very, very doable. And so we're constantly looking for those places where we can really make a difference. Because you're right. I mean, it's a huge, huge national problem. And Kentucky, in particular, Kentucky, as we know, is one of the poorest and sickest states in this country, right? So we get more disproportionately than a lot of other states.
Right.
And we're facing something that's called the unwinding of the Medicaid, which means that the special features that didn't question people's coverage that were put into place during the pandemic are going away. And we're going to be seeing people who are no longer automatically renewed, but they're again questioned. And when people are questioned about that, and there's they've estimated that something as many as 15 or more million nationally will be pushed off of the Medicaid rolls. And then on top of that, we're seeing something similar with the subsidies that have been going to people who buy on the exchange. And unless that is renewed in 2025, I think, then that group of people will either have to pay a lot more money or will be pushed off. So we really are faced with the situation in which we're going to see growing numbers of uninsured people. And how will we cope with that?
Yeah, and this whole structure frustrates me because it's not like when we stop funding these sort of social safety nets, it's not like the problem goes away. It's not like the people that we're suddenly not paying for just disappear off our rolls. They will continue to be here. And for me, even let's say hypothetically that we didn't care about people's health. Let's say all we cared about was the fiscal health of the government, right? Even if that was your only motivation, if you don't make those kind of investments in people, it's going to cost you more money in the long run to chase after the negative health outcomes. You know what I mean? It's still, those folks are going to be a bigger burden on the system than if we were supporting them in the first place. So even from a fiscal responsibility point of view, I think it behooves us to make these interventions and have these supports in place for people.
Vice Mayor Wu, what other places have done this, and how does Lexington compare with them as far as the investment that we're making here? I
Sure.
say we because I'm a Lexingtonian.
That's right. I've got Undo Medical Debt's website pulled up, and it's a pretty short list, so I can just go over the whole thing with you. Akron, Ohio, the state of Arizona, Cincinnati, Ohio, Cleveland, Connecticut, Cook County, Illinois, the state of Illinois, New Jersey, New Orleans, Oakland County, Michigan, Orange County, Florida, St. Paul, Rhode Island, Toledo and Lucas County, Washington, D.C., and Wayne County, Michigan. And that's it. That's the whole list so far of people. I think these are folks that are either in contract or have already done the medical debt. So we're not on there yet, but hopefully we will be on that list in a few weeks. In terms of our sort of figure, it varies. There are states that have relieved more. I think their first partner was Cook County, and let's say Cook County, Illinois, they have erased over $280 million worth of medical debt. So they invested at least 2.8 million from that figure. But there have been places that have done smaller figures as well. So I think we're kind of right in there. I would probably say it's relatively proportional to the population of these cities. So I imagine New Orleans probably had a bigger, investment than a city that would be smaller than us. Akron is probably comparable to us. But that's just my guess.
Well, certainly Chicago, Cook County, they're a lot bigger than Lexington.
That's right.
Right? One of our people here on this call, Evan Hawthorne from Pikeville, told us that he's looking into this for down here in Kentucky. Is that right, Evan?
Yes, it is. I have been in contact with Undue Medical Debt as well. And I've got the idea. You mentioned Akron on the list of places that's already done it. That was one of my friends from undergrad. He was a medical student at Neomed in Akron, and he kind of spearheaded their whole project. And so I got the idea from him, and I have been trying to work on it for at least Pikeville, Pike County, and potentially maybe Floyd County as well. But so yeah, I guess Harriet kind of already asked, but you didn't face that much pushback theoretically. If you had, how would you have gone about navigating that? And also, did you use ARPA funds?
Right. So a lot of the municipalities and city governments started using ARPA funds with undue medical debt about 2 years ago, 2021, 22.
Do you mind explaining what ARPA funds are?
American Rescue Plan Act.
Okay.
Basically
Thanks.
the COVID rescue money that we all got.
Okay, thanks.
Yeah, I think Lexington got $120 million in ARPA funds. When the ARPA funds came down, they gave you a limited amount of time to allocate it and a limited amount of time to use it. So I think the allocations had to be done. I think the end of this year, we got all of our stuff done pretty early, and all the money had to be used up. I want to say end of 2026, something like that. So for us, we were actually going to fund it out of the general fund. We just happened to, with an amendment made by one of my colleagues, we're actually using interest money from ARPA to pay for this. And that interest money, because it's our money and not ARPA money, we can spend it in whatever way we like and take as long as we want to with it. So we don't have the ARPA restrictions. So for all intents and purposes, we're using our own general fund money for it. It's not tied to ARPA. In terms of pushback, I would argue on a couple of different ways. I would argue on the investment angle of like, this is money that we're gonna kind of put up front to solve a problem instead of letting a problem exacerbate and kind of become a bigger financial burden on us. And B, argue the return on investment part of it. You can't get better than 100 to 1 on your money in almost anything you do. If this program were a 10 to 1 on your money, if this program would have required the city to put in $10 million, it would have been a harder sell for me. I think it would have been a harder pitch to make because, we're required to balance our budget. So it's a zero-sum game. If you take money from something, if you spend money on something, you have to take it from something else. But for us, $1 million to relieve $100 million in debt was kind of a no-brainer. And again, on the health outcomes part of it, we in Lexington have 3 major hospital systems. Baptist Health just built a new facility out in Hamburg, and UK Health is about to build another facility right across the street from them. So we are the absolute hub of healthcare in central Kentucky, right? People from surrounding counties are using our facilities, people in our own county. So how can we be a leader in healthcare and not lead on something like medical debt, right? How can we just be, relieving people's medical issues and still burdening them with all of this debt. So I wanted to ask you, Evan, have you talked to legislators in Pikeville? Have you talked to like council members or commission members?
Briefly, I'm meeting with them this week to go more in depth. Yeah, but I have not fully fleshed out what the plan would look like.
Did undue medical debt give you a ballpark estimate of how much debt there is in Pikeville?
Yes, it was around 250,000.
Okay, and 250 is the investment, and then multiply 100, or
so $250,000 dollars in medical debt that they have access to in Pike County.
oh wow, so that's so that's only 2,500 is the investment then? Because divide by 100. Am I
Yes.
doing that right there?
It seemed pretty small to me as well,
Oh, wow.
which is why I considered opening up surrounding counties, because that seems like a very doable thing.
I was going to say, if all you have to do is raise $2,500, I mean, I think you can do a GoFundMe at that point, and get to it. And so, yeah, it's such an interesting like issue of scale, right? So I think that amount of money, it'd be hard for me to think of people who would argue against spending, a few $1,000s to relieve that much debt for, at least several hundred, local residents.
I don't want to speak for the treasurer of Kentuckians for single payer healthcare, but we could even write a check for that.
Right? Yeah. So
That's
that's part of what we've been thinking about too, for future moves too, is to get in touch with folks like Bluegrass Community Foundation and other charitable organizations to potentially help and expand this work a little bit. As we said, like we're using city dollars, so we can only use it for, our residents. But if we wanted to help people from surrounding areas, there are partnerships that I think can happen, public-private partnerships between local governments and charitable organizations.
It
Go ahead.
occurs to me that maybe in Pike County, Floyd County area, the dependence on Medicaid is probably responsible for the lower amount of debt that's out there.
Well, I kind of have a question that it's maybe related to that. Does undue medical debt, do they give you sort of a report on which debtors, I hate that word, but which debtors were not served, were helped? For example, like we've recently heard that some hospitals are going to make young mothers or young parents prepay a maternity, a delivery. And so do you get data back that said we helped X number of people under the age of 20, under the age of 30, or on Medicaid? I mean, the data that you get back, I'm sure there's a limit to. And
Yeah.
they don't want to reveal names, do they? No names would be revealed.
Correct. Yeah. We wouldn't violate HIPAA anywhere there, but I think they do collect that data. I am very, very interested in seeing what that data looks like, because I think it would also help inform our other social services and the way we look at helping our constituents in Lexington. If the data came out that people of a certain age were more likely to hold more debt than people of a different age or gender, or on, based on race, based on even parts of town. I think that would be really interesting to see.
Right.
We already know-
Right. Race has been a factor in this.
Absolutely. Race is a factor in pretty much everything that we measure in America, and race overlaps, sometimes almost completely with socioeconomic status, with redlining, with all kinds of other factors. This country has systematically, oppressed people in very different ways, whether it's through medical health or through, lack of home ownership, lack of education, all those things. So they're all going to map on top of each other. We already know that. I am very, very interested to see the stats that we get out of it. Another thing that happens after folks get medical debt relief is they will often write letters into undue medical debt to say like, hey, you've really helped me out. You've improved my life. Here's my story. Here's what happened to me. Here's why I got into this debt. So I'm also really, we have the quantitative data, right? But I'm really interested in that qualitative part of it as well, of people reaching out to us and telling their stories. I would love to kind of talk to some of these folks, the folks who would be willing to speak publicly about it and kind of come and tell their stories a little bit, and for us to get a better sense of like who our residents are, who our most marginalized and challenged residents are.
I think that that's really important because for me, the thing that I find most compelling about this work is that it shines a light on the crisis that we have in the country. For those people who are healthy and are not going through any of this, may not be aware how many of our fellow citizens are exposed to a crisis that threatens their economic ability to sustain themselves as well as their health and even their lives. I mean, it's estimated that we lose 68,000 people a year from things that they didn't need to die from, that we could have solved, but they did not get the care because either they were uninsured or underinsured, or for some reason this system did not pick that up and take that. So I think, airing for the nation the crisis that we face in healthcare is really important. So we appreciate that you're doing that. I would like to raise another issue that's really, really important to us, and that is that our hope is to propel the nation forward to enact a national single-payer system that would cover everyone in the crisis. And there are 4 areas of our state that have taken that position. One was Louisville Metro Council a number of years ago, probably back in 2007, I think, or something. And Morehead City and Vico, beautiful little Vico in Floyd County, I think it is, and Boyd County. All of those cities have taken the position of calling on their congressional representatives to support an improved Medicare for all, a national single payer plan, as a way of trying to push ahead the country on doing something that will really solve the problem. What do you think of that idea of such resolutions?
Yeah, I personally obviously very much support that idea. I think a lot of folks on council would as well. I'm sometimes skeptical about these sort of non-binding resolutions that cities put forth towards things that are out of their jurisdiction, or you know what I mean, that we're trying to potentially push the needle or impact federal legislation on. So I'm certainly not opposed to it. I don't know at what critical mass it would require for our federal legislators to take action, and I don't know that it's a big stack of resolutions from different cities from all over the country, or you know what, maybe we can try campaign finance reform. That might be something that could really get us there too. But to your point, Kay, about the idea of shining a light on all the issues with this current system we have now. I mean, the recent event of that healthcare CEO being killed in New York City has really raised this conversation to a national level. And
Wow.
2-1, every single person seems to have some sort of health insurance or healthcare nightmare story to tell. And that tells you that, none of these issues are anomalous, that these are widespread systemic issues. People often like to say systems like this are broken. They're working perfectly. these systems are working as designed.
As designed for the profiteers, right?
Absolutely right. Absolutely right. Otherwise, we would not have this universal sort of outpouring of stories and of this frustration with this system. So again, I go back to the idea of like, what can I do as a local lawmaker in a city that it's very hard for me to impact that from a systemic level. So what is it that we can do to make lives better for our residents? And we just all kind of doing what we can.
Good job. Good job.
I guess when I have this conversation with local lawmakers, I always remind them, especially a fellow like you, that someday you may find yourself at a different level.
Why would you hope that for me, Paul? No, thank you. No.
I don't hope it for you, but I hope it for the benefit of everybody else, that the good work that you could do.
No, I appreciate that.
Well, the one I tried to do a little bit of reading and read about a family where both parents were insured, and when they sort of started, and they had 4 children, I think, everybody pretty healthy, and then all of a sudden they were hit with a whole bunch of medical situations, and their deductible was $6,000. And it was the deductible that put them into medical debt. And, for people used to paying their bills, just having that albatross hanging over their neck. Well, anyway, you're doing wonderful work.
Yeah, it's really, I mean, this issue is tied with so many other issues in our country. When we think about homelessness, so many families are one medical crisis away from being out on the street. You know what I mean? When they hit these deductibles and suddenly have to pay tens of thousands of dollars out of pocket, like a lot of Americans don't have a reserve of cash waiting for emergencies. You know what I mean? Everybody is budgeting, as hard as they can on it, and so these kind of issues end up rippling out to other issues, into unemployment, into homelessness, into substance use disorder, exacerbating mental health, exacerbating, domestic violence, child abuse, just kind of everything. So if we can kind of intervene in any of these elements, even a little bit, I think we're trying to move the needle the other way.
I have an acquaintance. I certainly won't call him a friend but he's here in Louisville. He's a venture capitalist, and he has gotten into buying credit card debt. Now he brags about the fact that he can buy it for 7 cents on the dollar. So I'm curious why the medical debt would be so much cheaper per se than credit card debt.
That's a great question. I don't have an answer there, but yeah. What do you say to your friend when he's bragging about these great deals that he's getting?
I don't acknowledge it. It's just a parasitic vocation, and it's like that's what's wrong with our system, our society today, is that. So like I said, I don't call him a friend. He's just someone that I happen to know.
Yeah.
He's going to hear you on radio now, Paul. If he wasn't,
this guy would never be listening to community radio, never.
With the outpouring of stories that have erupted in the wake of the assassination of that healthcare CEO, it seems to me clear that there is a base of support within our country that could propel national legislation to solve the problem, and that we just have to find a way to put it into motion in a way that will impact the nation politically, because clearly this is not a problem that the other wealthy nations have. And I'd be interested in, do you think there's a way to do that? How do we propel that grassroots movement into something that changes what is politically possible?
I'm going to say something that may sound very, very cynical. I'm hard pressed to think about changing minds of some of our decision makers and lawmakers. And my best tactic is to vote them out and bring in people that will.
Right.
That's why I ran for office, is to bring new ideas and new approaches to it. And so I think it's very hard to move entrenched politicians and lawmakers who have especially been there a long time, those with no term limits, those whose pockets are lined very deeply with these big corporate interests. I think very, very hard to move them because it's in their interest to keep the status quo. So I say try to cultivate, candidates, grassroots candidates, put support behind them, put party support, non-party support behind folks, help get people elected, especially on the local level, and then moving up into the state and federal levels.
Again, Vice Mayor, that's someone like you.
Um, we have to have hope. Kay worked she and her husband in particular, very active in the civil rights movement, and did accomplish something. And I belong to the League of Women Voters, and eventually women got the vote. But it was a long, hard struggle. I mean, we forget about the women who went to jail, even, force-fed. But anyway, we have to keep fighting. We know we've got good people like you on our side. Now, this is really off the wall, but I do a Twitter for our group, but I don't know if people know I'm behind it, and every now and then Kay posts on it too. But lately I've put a couple of, at Elon Musk and at Doge, DOGE, right? The Department of Government Efficiency. I mean, that new Commonwealth study that just came out, Mirror, Mirror on the Wall, that shows how really dreadful we are compared to all the other advanced nations. And if they're talking about making us more efficient, and then I've even posted the conservative economists who are with some George Mason University group called the Mercatus Group, who have said we would save billions within the next few decades if we switch to single payer. And the latest one is our own CBO. And what's that? Congressional
Budget Office.
Right. So, I mean, every now and then you have to do something that's kind of crazy and off the wall, but nobody expected the outcry that we've seen this past week. And apparently they have a suspect in custody right now. But, well, anyway, we have to keep getting the story out. And your story of taking action for your community is really to be applauded. And we thank Steve for bringing it to our attention.
Yeah, and I really appreciate all the work and advocacy your group does as well. I'll say one thing, Harriet, in terms of when you talked about the CBO and conservative organizations looking at single payer as a way to save money and be efficient, I'm reminded of the fact that I have to remember to know who I'm talking to. If I'm talking to a particular person, I may say, hey, single payer healthcare is the right thing because you have to value people and you have to put people first and their health first. If I'm talking to a different type of person, I can talk about the fiscal savings and the fiscal responsibility of it. So you have to go to where people are on these issues. And I think the right ideas like single payer healthcare, there are so many different angles that you can sell it. And you just want to make sure you're selling the right part of that product, essentially, to the right person and not kind of barking up the wrong tree, so to speak. So I think they're just different tactics, but you have to know the person you're talking to. You have to know what motivates them to get them there.
You're right. You have to know who your audience is.
And Harriet, I think maybe it was the day after that terrible shooting in New York, I saw Elon Musk on Twitter putting out charts about how much waste there is in our healthcare system, allegedly healthcare system. My personal view is it's, as currently structured, more of a wealth transfer system than a healthcare system. But Vice Mayor Wu, when you get those testimonials of people whose lives were changed in a positive way, pass them on, because we like to shine the spotlight on them too, and perhaps amplify it if we can.
Yeah, absolutely. I will. Hopefully too, when this stuff gets rolling, you will start to see newspaper articles and op-eds. I will be hitting the interview circuit and letting people know that this is happening. And hopefully we have a ripple effect. Hopefully we spend that entire $1 million, which means that'll clear up all the uncollected debt in Fayette County, and then all of our surrounding counties and neighbors and friends will see the positive effect that we're having, and we'll start fielding calls from Woodford and Jessamine and Scott County and everybody else, and all the way down to Pikeville.
Right.
Is this something that you would want to continue in future years, even though you said the money may not be there, in this large a sum, but at least in some capacity in the future?
I don't think so at this moment. I don't think doing regular debt relief is the solution, because it is really just slapping Band-Aid after Band-Aid after Band-Aid on the same problem. We want to address some of these underlying problems, but I'm hoping that this will get enough attention that we can kind of really have this conversation and really talk in a more robust way about what are the ways we can address the underlying issues. How do we get people better healthcare, freer healthcare, or free healthcare? Some of the conversations I've had with people from these medical institutions, they've acknowledged that this system doesn't even work for them. They've acknowledged that they want to do things in a better way. So what that looks like, I'm not sure, but I would love to bring folks on board and have those deeper conversations with our big health partners to say, like, how do we continue to provide healthcare for people without demolishing their pocketbooks and their credit scores like this? I think there's a willingness to have these conversations now, which is great.
Right.
Well, we're always looking for people to come on and do our radio program. So if you run across anybody that you think might be beneficial, please send them our way.
Absolutely.
Well, and another thing I read is you can't just raise your hand and say, Vice Mayor Wu, will you abolish my debt? You can't make up, I'm very worthy and I'd like you to abolish my debt. No, it has to be a kind of community-wide thing. You don't sort of, and somewhere I read, I don't know if we have time to discuss this, too, something about difference between newer and older debt.
Yeah.
So is it better for you all to buy
We're working on undue medical debt as an organization takes on older debt. I'm not
older
entirely
debt?
sure
Okay.
what the age range is of that debt. And again, the city of Lexington and city council, we're not picking and choosing winners and losers in this. Undue medical debt has a pretty strict criteria by which you can be eligible, and then it's a matter of those negotiations with the hospital systems in terms of how much they want to sell for how much.
Thank you.
I think the work that this will do in Lexington will certainly serve as a model for a lot of the surrounding counties. My question is do you think that this is something that the state maybe should eventually take on? I know you mentioned Arizona did it as well.
Yeah,
but the second angle to this is also as you move up, is it, what is your magic wand that would be how do we get rid of the underlying problem? Is it really just a structural thing that requires the federal? Is there maybe something that the state could do so that you don't have to keep buying this medical debt?
Yeah, I think state level participation would be great because otherwise it's really piecemeal. We have 120 counties in Kentucky. So to get everybody on board and not just the counties, but all the little municipalities and cities on board, it would be very, very patchwork. And then suddenly you're not reaping the benefits of somebody who lives 10 minutes away, right? Because your city didn't take it on. So if we can do it at the state level, I think it would be really, really fantastic. And the underlying solution, I mean, it's the name of your group, right? It's single payer healthcare. There really isn't everything else. Again, we go back to the Band-Aids analogy. Every other solution is really one form of a Band-Aid or a crutch or a brace or a cast. It doesn't address the underlying problem, which is the privatization, the profiteering of the healthcare system. That's really it. And until we get to that point, we are just slapping very well-intentioned band-aids on this problem.
You know, we made a reference to Elon Musk making some statements recently, and what I heard, and I saw that same article, whatever it was on Musk, but you know, I'm thinking, yeah, he's gonna cut the waste out of our medical systems, and his idea or his solution will be Medicare Advantage for all.
I don't
And
know if that, did he say that or did that come out of that project 20?
Dr. Oz,
Yeah.
Dr. Oz, Trump's nominee to head
Oh, okay.
CMS, was a proponent of Medicare Advantage for all.
Which would be, in our opinion, disastrous because it supports the for-profit insurers.
And a lot of the people that have medical debt have Medicare Advantage.
Well, that's what we want to see, those data, don't we?
Yeah, it's hard for me to take at face value or take in good faith really any recommendation from this this administration as it's building. I mean, it's really like he's putting together like America's biggest oligarchy at this point. And so it's impossible for me to take on good faith, even not knowing the facts of each of these proposals. Just the fact that they're essentially all coming from millionaires and billionaires makes me pretty skeptical.
right, you mentioned earlier the oppression of demographics, certain demographics, and this incoming administration has made it pretty clear they're only going to intensify that.
This is Kay Tillow. You're listening to Single Payer Radio. We have been having a discussion with Vice Mayor Dan Wu of Lexington, Kentucky, who has successfully gotten a resolution passed that will buy $100 million in medical debt and forgive the debts of 40,000 people in the Lexington area. And we thank you, Vice Mayor, for being with us. And we appreciate all who have participated in this program.
Thank you for listening to today's program. This is Paul Hoppy wishing you a very good rest of your day.